me right now for more on this is Dr. Pernell. She's a public health physician and fellow at the American College of Preventive Medicine. So, Doctor, I want to ask you first about some of these important updates that we heard from the FDA this morning. Some new moves, authorizing the Pfizer booster dose for kids ages 12 to 15 years old, shortening the time before the booster, for a booster for everyone. It's been 6 months, and now they're saying you can get a booster after 5. And then the FDA just gave the green light for a third primary dose for immunocompromised children ages 5 to 11. All moves, all announced this morning. What do you think of this?
Morning, Kate, and a happy new year. Those 3 moves are all moves that I greatly welcome because the data just supports it. We know that against Omicron, if you are to be protected, that you need a booster. So the fact that now those 12 and above will be eligible for boosters, that's the right move. Second, we know that from data released out of the labs that your antibodies really begin to wane around the 20 weeks mark. So having that booster be available at the 5th month post the completion of your primary series is, again, another welcome progress. And then third, seeing those who are immunocompromised in children able to get a third dose is the right move. It's the same move that we made with adults. We want people to be as protected as possible in the face of Omicron, knowing that Omicron is definitely able to evade the protection and the effectiveness of our currently available vaccines.
This is all part of what we've all, scientists and non-scientists alike have needed to get used to, which is just the evolution of the understanding of the science. As we learn more, things change. We're also hearing now, just along that vein, we're hearing from Dr. Fauci as well as others that they believe the focus needs to shift a bit on how we measure where we are with this virus, to focus more on the hospitalization rate rather than the infection and the daily new case rate. What do you think of that, Dr. Pernell?
I don't quite agree with that. So if you think about whether or not we're focusing on daily case rate versus hospitalization, one is a more acute issue and the other is a more long-term issue. Where we have stumbled in this nation is our lack of preparedness and our lack of vigilance and awareness around all factors that are on the field. So whether or not new cases are exploding is very important to know when upwards of 30% of those who get infected could potentially develop long COVID, as well as knowing what the surge looks like on our hospital and healthcare systems. Look, I know that we in healthcare are beleaguered. The entire nation is beleaguered, but especially those of us on the front lines of care. And we need to make sure that our workers are protected. And that's why we can't lose sight of both of those 2 very important things.
Gabe Cohen, my colleague, was just talking about kind of all of the concern, the risk, the fear, the anxiety, the big questions in front of school districts, schools, and parents right now as kids are heading back to class. What do you tell a patient, a parent who comes in and sees the infection rate, sees the hospitalization rate, maybe in their community, and asks, should I be sending my kid to school today?
First and foremost, I'm continuing to have this conversation on a daily basis. Make sure your kid is vaccinated. Largely here in New Jersey and even across the nation, those children who are getting infected and hospitalized are those who are unvaccinated. So that's the first thing. Make sure everyone in your household is vaccinated. And then 3, hold your school systems accountable. Ask questions around testing, access to testing, ask questions around physical distancing where appropriate, and more importantly, ask questions around filtration of air. All of those things are important. We must not ever forget that to beat this pandemic, we need a multi-layered approach. We can't just focus on one or the other, and that's what I want parents to know.
Good advice as always. Dr. Pernell, thank you.
Thank you.